so discussing the education portion of injectables, we have first intradermal injectables, so that's going to be administered at a 5 to 15 degree angle. The gauge of the needle is going to be between 25 and 30 gauge. You're going to use between a 1/4 and a 5/8 inch length needle. The trick to when injecting is you're going to insert the needle bevel up, and after injecting you're going to look for a bleb to make sure that you've injected into the proper region of the skin. And typical locations are going to be in the anterior portion of the ventral portion of the forearm, as well as the upper chest and the upper back. And this needle is going to be, an example of it is going to be a tuberculin needle like this. This example is a 27 gauge, 1.5 inch length, and it's going to be 1 milliliter. The most that you're going to inject in the site is going to be 0.1 milliliters. The next is going to be subcutaneous. So subcutaneous is going to be injected between a 45 and a 90 degree angle. The trick for this is if you can pinch an inch of skin, you're going to inject at a at a 90 degree angle straight in. Otherwise, you're going to inject at a 45 degree angle. You're going to also use a 25 to 30 gauge needle. This length is going to be a little bit longer, so you're going to need it to be between 3/8 and 5/8 of an inch long. And the sites of injection are going to be in the lower abdomen, at least 2 inches away from the umbilicus on either side. You can go into the anterior aspect of the thigh. You can do into the back of the arm, or you can do into the lower back, what is colloquially known as the love handles. I would never use that with a patient, but for my own knowledge, the love handles or lower back is a viable site as well. And then finally, we have the intramuscular injections. So that's going to be at a 90 degree angle all day, every day. It's going to be 20 to 24 gauge needles. The length is going to be between 1 and 1.5 inches. And there's 3 acceptable sites. So you're going to be in the deltoid. So for the deltoid, my person example is going to come over. So for the deltoid, you're going to take 3 fingers. You're going to find the acromion, and you're going to take three fingers, and then about 2 inches, kind of depending on your personal anatomy. And then you're going to go just below that 3-finger site, basically directly into the triangle, in the middle of the triangle of the muscle. The next site is going to be into the vastus lateralis. So the trick for this is going to be, you're going to find the greater trochanter here. You're going to make an L, and then you're going to find the lateral femoral condyle, which is here, and then you're going to go in the middle of the rectangle, which I'm trying to not block it with my arm, but it's going to be here into the vastus lateralis. And then finally we have into the ventrogluteal. So the trick for finding this is you're going to find, thank you for standing, you're going to find the greater trochanter. You're going to place your palm on the greater trochanter. You're going to place your middle finger on the anterior superior iliac spine, and then you're going to point your pointer finger at the top of the iliac crest, and you're going to go inject straight into this site. And if not mentioned before, the maximum that you're going to administer into the deltoid is going to be 1 milliliter, and you're going to inject up to 2 milliliters into either the ventrogluteal or vastus lateralis muscles, and you're typically going to use a 3 milliliter syringe with this, for example, is going to be a 22 gauge 1.5 inch needle, and you would affix that to the Luer lock syringe. And then the example of the subcutaneous needle is going to be an insulin needle, and so this one is 0.5 milliliter, 29 gauge, and 1/2 inch in needle length.